Hi, welcome to Success Factors. I'm your host, Brenda Siri, and today I am joined by two very special and important men in my life, my husband, Andy Siri, and his doctor, Dr. Zain Mirza, who is an orthopedic surgeon and owner of Texas Spine and Pain. Welcome to you both.
Thank you.
Glad to be here.
Great.
Thanks for having us.
You bet. So, Doctor, you have been featured in D Magazine as one of the best award-winning spine surgeons here in Dallas, and you have over 10 years of experience. And I wanted to have you on the show today because you operated earlier this year on the most important person in my life, my husband. I know you do some very cutting edge surgery, and I've had a lot of people reach out to me, and I asked if it was okay to reveal this, that Andy is 72 years old. And I've had so many people reach out to me and say, I can't imagine having surgery like that at that age. How's he doing? Is he okay? And he's doing great. And we both attribute so much of that to you, to your expertise and your surgery that you did for him. And one of the things that's really important in selecting a surgeon is knowing that you've picked the right one. And we know that we did for sure. So Andy, I'm going to start with you. I just mentioned the fact, sorry to rub it in, you're 72 years old. You are a former semi-professional soccer player, and we've talked a lot about maybe that's what happened to your neck. What do you think? What happened?
Don't really know. I mean, it's very probable that played a part, maybe a significant part in it, because there is a lot of head motion, especially heading balls, diving for shots when you do use your head and you're in a tight space. But I'm a very active individual, so it could have been started when I was a kid. I have no idea. He might be able to explain it better than I can. But all I know is that there came a point where I suddenly realized I had a problem.
Yeah, what was that point?
Playing cornhole on Father's Day 3 years ago. We played cornhole with friends and stuff a lot, and I was always pretty good at it. And all of a sudden, that morning, I guess it was afternoon, I realized that I couldn't control my right arm, my right hand, when I would release that bag. Sometimes it'd go down when I was trying to push it up. If I tried to force it to go up, it was sky shots. And I realized in that moment that there was something wrong, and I thought, maybe I'm just tired or something. I even remember telling you we're going to play some more because you were kicking my behind in it. That we were going to try some more, and I wanted to see if I could work through it, and I couldn't.
Yeah.
And the next morning, I remember getting up, and I was actually trying to do some self-care, some shaving and stuff, and I realized that I couldn't move this hand and control it the way I wanted to. I had never noticed that before, but it suddenly became apparent to me there was a problem.
Right.
So I told you I wanted to go to an ER clinic and get checked out, because back in the back of my mind, I'm going, did I have a mini stroke and I didn't know it? I didn't want to take the chance being my age. So I went, and sure enough, the doctor who saw me in the ER clinic checked me. She looked at my face and she goes, she says, the right side of your face does look different than the left. And she saw my bicep. The bicep on my right was smaller than the bicep on my left, which I don't know why a stroke would have done that. But she said, I think you should go straight to the ER. And I did. I went to an ER. They ran a CAT scan and came back and said, you've had a stroke. This is the funny part. They admitted me. Middle of the night came, got me for MRI and some other tests. The next morning, I've got a neurologist in the room telling me you haven't had a stroke at all. He goes, it's C4, I think it's 4, 5, and 6. Your vertebrae are compressed. And, you've got nerve constriction or some type of issue with the nerves that's affecting the right side of your body.
Right. And I know that they did, tell you that they felt you needed to have surgery right away. And I remember your reaction was, I'm not having surgery, right? I mean, it was scary and an unknown. And you finally got to a point where you needed to have surgery. So what was going on with you that you knew you needed? It was time, and, you had to move forward.
In my past, my father had 4 back surgeries over the course of years. He never got better after each one of those surgeries. And I view surgery as the final step. So I went to seek chiropractic help to see if there was a way to maybe help the situation and at least prolong it for a while. I went through spinal decompression. I learned how to exercise to help strengthen muscles in the upper back and even in, around my neck to see if I could help the situation. But it finally got to a point to where I realized, it was probably about 2 years after, I'm going, it's not getting better and I don't want it to get worse. So it is probably time to look at surgery and a surgeon. But the scary part of that is you want the best working on you.
Sure.
And, how do you determine who's the best?
Right. True. And we're going to talk with Dr. Mirza in a minute and learn a little bit more about what he did to you. But it's been just a little over 6 months since you had the surgery. And for people that might be watching that have asked me, how it went, how's your recovery been?
Much better than I thought or expected. Again, with kind of preconditioned to having watched my dad go through things and it not being well. I really felt that there would be probably a lot more pain and discomfort involved. Truthfully, after the initial drugs wore off in the hospital, I had almost no pain. I had a little bit of cramping, as you had predicted, in muscles in my upper back, just because of the waking up of the nerve. But I took very little pain medication following surgery. I have followed the instructions, your instructions on what to do and what not to do. I've worked with rehab and my recovery has been phenomenal. Yeah. I felt ready to go back to normal before I should go back to normal because I felt so good.
Yeah.
It's been really good.
My last question for you at the moment is, thinking back on this and that 3-year span of time that you sort of prolonged having this surgery, and now that you've been through it, do you think maybe you would have done it sooner if you had known how it was going to go for you?
Yeah, because during that time, I lost probably more ground in terms of use. And I know that I have really about the first year to regain. And I have gained quite a bit back. It may never be totally back to normal, but I think sometimes timing is also important because 2 years earlier, might not have discovered Dr. Mirza, so I'm not certain that I would have felt comfortable going through with the surgery, because that's a big step to me.
Yeah, absolutely. Well, Dr. Mirza, again, thank you for coming back on the show. Appreciate having you here.
Absolutely. Thanks for having me.
I know up on the screen right now, we've got what looks like a normal MRI, and you will show in just a couple of minutes what Andy really looked like inside. But for someone who is not a medical professional, what is that we're looking at? Why does that make that a normal MRI?
Sure. So in your spine, you've got bones, ligaments. Their job is to protect your nerves. And in this MRI scan, the main nerve, which is that oval in the middle, that's the spinal cord that connects your brain to the rest of your body. You're supposed to have nice white space all the way around that oval, and that's what a normal MRI looks like. And that white space is the space available for the spinal cord to move every time you move your arms, move your neck, move your lower back. That's the buffer zone for the spinal cord, where it's protected within the confines of bones and the ligaments and the discs. And that's what a normal should look like.
Okay, and then the next slide is
So
Andy's.
now, yes. So in this one, you can see a couple of things. One, that white ring around the spinal cord it's no longer there. It's very, very slim. And two, instead of that spinal cord, instead of looking like an oval shape, it looks more of a triangle because it's being pinched. It's being compressed by the bone spurs and the discs in the front, and that's what's causing that's what caused a lot of his symptoms. What happens is your spinal cord is a connection. It's essentially a main highway that connects your brain to your body. If there's a block anywhere in that highway, then you can't communicate fast enough with your muscles, in your case with your arm, and that over time you start losing the functions of those muscles and eventually you lose that muscle completely.
Yeah. I know in the beginning when I was asking him questions about his soccer career, he said, maybe that's what happened. I don't know. Knowing that he went from feeling completely normal one day to just really seeing the loss of use, it probably was an older injury, but what do you think?
It's very common. So these things develop over time. These bone spurs develop for two reasons usually. One is your lifestyle, in your case, your soccer. Anytime you do any head injury, any neck trauma over time, that builds up, and that the discs and the bones in your spine take a toll over time. And then the second thing is your genes. So if you had similar issues in your family, in your case, your dad, that transfers down to your body as well. So in your case, you have two risk factors that cause this over time: your soccer career and your genes. With that being said, this particular problem, it's a very common problem in the world. The type of surgery that we did and the type of problem that you had, it's probably the most common type of spine surgery that all spine surgeons do in the world, because it's such a common problem that people develop.
Wow, that's interesting. I remember coming in with him before surgery, and you had said, if you don't have this surgery, you could end up paralyzed. How is that? That's
going back to that buffer zone. So that buffer zone is naturally there for your spine to be able to move back and forth in that space. If someone with that MRI takes a bad fall or gets into a fender bender, a car accident where the spinal cord doesn't have that buffer zone, then that spinal cord hits against that bone spur that you see, and that's what kills the nerves completely. And that's what leads to paralysis in these scenarios.
Wow. Okay, now I know we're going to look at Andy's x-rays. And so this was before surgery. And what are we looking at here?
So again, this is the side view of his spine. This is a plain film that shows overall alignment and kind of like a view of the forest, whereas an MRI shows you the actual trees. So on this view, if you look at the top levels, between the bones is the empty space, and that's the space that is normal for the discs. But as you come down at especially that level at C4, C5, you can see the disc is completely worn out, and now he's got a lot of bone spurs there. And then even the bottom two levels on top of that. So that's what we're looking to see. One, what his overall alignment is. Two, how much of the disc space he has left and how much is worn out, and what the bones look like. That's what the x-ray is showing.
Wow. I know you do very cutting edge surgery. Can you help describe what the procedure is like that you did to him?
Yeah, so we did, it's called an ACDF, which stands for anterior cervical discectomy and fusion. What we do is we make a very small incision in the front of the neck that lets us get to where that spine is, where the nerves are. And then we shave off the bone spurs that you see up there. And once those bone spurs are shaven off, then we put a spacer in there, which kind of looks like one of these spacers, where you have essentially a cage is another name for these spacers. What they do is they replace the disc that's present in that area, and they open up the space available for the nerves. Eventually, if you look at the middle of these spacers, there's hollow space in between. That hollow space is where we put cadaver bone. That cadaver bone eventually merges in with your own bone over time, and that's what we call fusion. And that's where the word fusion originates from, because your bone then grows through and connects to these spacers over time.
Interesting. And I know we have a slide we can show of what the inside of his neck looked like after surgery.
Yes. So you can see now those spacers are holding up the individual vertebral bodies. They're maintaining the disc height that he's supposed to have for the nerves to function. And then in the front of those spacers is a plate, kind of like a plate like this one, which is holding all those spacers in place. This plate plus small screws that go through the plate like this, which are very, very small in real life. They look big in a picture, but they're very, very small. They're about 12 to 14 millimeters long, or a centimeter and a half long. And what they do is they just hold everything in place until your own bone eventually heals everything and goes through those spacers. And then the plate and screws have done their job. That process of bone growth can take up to a year, sometimes even longer. But about a year after the initial surgery, you'll start seeing bone grow through those spacers. And that's when the plate and screws have done their job.
So no riding roller coasters.
Yes, definitely no riding roller coasters. Yes. So after a surgery like this, like I said, these are small screws. They're there to stabilize things. You can overpower these screws with any jerky motions. So roller coasters are completely out. I used to tell people to use common sense until I actually had a patient who had a very similar surgery like yours, and day 2 after his surgery, when he was discharged, he went on a roller coaster ride. And at that roller coaster ride, all of that fell apart. And his excuse was, my discharge instructions did not clearly say no roller coasters. Ever since then, no roller coaster rides.
Yeah, right.
Yes.
Makes sense.
Yeah.
And really looking at his neck today, you can't even really see a scar. You can't really tell he's had surgery. Is that because, I know we talked when you were on the show before about using those augmented reality glasses. Does that contribute to that?
That does. In his case, though, we used a microscope, which also which helps with visualization. So instead of a massive traditional scars, we can make small incisions, like an inch or inch and a half long incisions. And I can see the whole spine 10 times bigger than what it is through that microscope. And when I do my lower back surgeries, augmented reality helps you do the same thing. In that scenario, you don't even have to cut before you can see things. You can see through your headset and the glasses that we wear. You can see through this different layers of your skin, your muscles, your bones, and all the way down to the nerves. And then you make your cut precisely where you need to put anything like screws and rods in. And that has been a game changer when it comes to spine surgery.
Yeah, absolutely. Yeah. And looking at this x-ray, one of the things that we talked about after it was over was, going in through the front of the neck. Do you have to move like the esophagus and all that stuff out of the way?
It sounds a lot more scary than what it is. Yeah. So we have a natural path right in between our esophagus and the muscles to go right where the spine is. Anyone can feel their soft spot right in between the two and push down. That's where your spine is. The esophagus and your trachea, which helps you breathe, we gently pull it away from the spine so we can work on the spine safely.
Wow. Yeah. What you do is amazing. Is this a permanent solution, or is there ever a need to repeat this surgery?
It is a permanent solution. So it's designed to help with the levels that we did surgery on. It's designed to help control issues at those levels. Now, you might have whatever caused you to develop arthritis in the first place might cause you to develop arthritis at other levels down the road. We don't know how far down the road. It could be 10 years, 20 years, could be 1 year. That all varies from person to person. So what I do in my practice is I keep an eye on after the surgery. I keep seeing you periodically over a time period, and we keep getting periodic x-rays to make sure you're not developing adjacent segment disease or problems in other levels in your spine. But for the levels we operate on, it is a permanent solution. Yeah.
So with his age, so many people were concerned about his recovery and how it was going to go, and it just seemed to go really well. For maybe a younger patient or someone who's, in their 30s or 40s, what's the normal downtime and recovery time from a procedure like this?
For this particular procedure, people do really well from recovery standpoint. I have had a patient that got this same surgery on a Saturday and went back to work on Monday. So he was the fastest one that's ever recovered. Most people like to recommend at least 2 to 6 weeks where they take time off. So that way, like you said, you had muscle spasms afterwards. Those muscle spasms tend to bother people more than pain. So that way they can be on medication to control those spasms. So about 2 to 6 weeks is a good time period after surgery.
Okay, that's good. And I know, Andy's doing so much better since having this surgery. What percentage of body function can most people expect to get back? Andy had really lost a lot of use in his right arm. What's the percentage you can typically get back?
It depends on how long, a few factors. One is how long the nerve was pinched, how much of that muscle mass he's already lost. All those factors play a role. What we look for is a vector, a trajectory of improvement. In the first year after surgery like this, you keep on getting better each month. You keep on recovering. Each nerve in your body grows about an inch a month, or recovers about an inch a month. So you can imagine how long it takes for that nerve to slowly get down to the arm. So that's why we give it a whole year before we say you've reached the maximum amount of recovery possible.
Got it.
Yeah.
Well, I happen to think you are the best spine surgeon in all of DFW. And if anybody's watching today, I know that you have your offices in Plano, but you do operate at several hospitals throughout DFW, correct?
Yes, yeah. We have a couple offices, Plano, Frisco, and Irving. And then I operate out of multiple hospitals throughout the DFW Metroplex, including Baylor, Methodist, Medical City, and Texas Health. Yeah.
Fantastic. Yeah. Well, thank you from the bottom of my heart for making my husband better. I know you're very thankful as well.
Absolutely.
And it was great having you on the show again. Thank you so much. And Andy, I think you would tell anybody watching, it's not that bad, right?
Nope, it's not that bad. I can honestly say I thought I'd have a loss of mobility of even my neck, and I am amazed at how well I function and my ability to turn my head and move. Yeah. It was significantly less than what I thought.
Yeah.
And 72 is actually young for patients that see me. The oldest I've ever operated on was 100. Yes.
Wow.
And he lived to be 101.
Wow. Yeah. That's amazing. Yeah. Okay. Well, young guy, you're doing good.
Back to work.
Yeah, right. Back to work for you. Well, thank you both for being on the show today. I really appreciate it. And we'll see you next time on Success Factors. Thanks. Bye.